My name is Amber and I'm a student at NCTC, and today I'm going to be giving a presentation on what it's like being a dental assistant. Have you ever suctioned blood and saliva from a tooth being removed surgically, packed gauze, taken x-rays, answered the phone, and even had a snack between patients all in the same day? Unless you have worked in the dental field, I'm going to guess that none of you have ever done all of those same things in one day. So this topic is actually very relevant to me because I myself am a registered dental assistant through the state of Texas. I obtained my degree at Weatherford College and got my license. I'm going to be talking about what a registered dental assistant does through their day and explaining the difference in a front of office assistant and a back of office assistant. So what is a dental assistant? In the short term, a dental assistant is a dentist nurse, very much like a physician has a nurse. They're going to assist the dentist throughout the day and whatever they may need. So a front of office assistant is not going to assist chairside. Their main place of work is going to be the front desk, and a back of office assistant is going to work side by side with their dentist all day long and be 100% hands-on. So according to Miranda Brown, a dental assistant of 28 years, both front of office and back of office assistants are vital to the practice. You just can't have one without the other. They create a balance throughout the practice. So the assistant's attire. The front of office attire is typically scrubs and sneakers and don't require any PPE. Some offices are casual and let the front of office assistants wear business casual outfits, but they typically don't have to have any protective gear. A back of office assistant typically wears scrubs like I have on right now, tennis shoes, a lab coat, which I wear mine every single day. When we're assisting or doing instruments, we're going to have our gloves on to protect us from any bloodborne pathogens. We're going to have our protective goggles on, and typically a mask, which I don't have a mask on because you can't hear me very well if I did. And then I have my stethoscope here, which some offices have an automatic blood pressure taker. But I have this because before we start our procedures, we have to take our blood pressure on our patients. Now that we can visibly spot a front of office assistant and back of office assistant, let's probe into what each does. According to Kay Smith, assistant of 9 years, a RDA is the backbone of the practice. They have to juggle many tasks at once. If assistant can't multitask, they most likely aren't going to help the office flow or grow. Now that we know the two main types of assistants, we can move forward and look at the root of each RDA's work. So, a front of office is required to answer phone calls, schedule appointments, confirm all appointments for the following day, take payments, file and pull charts, export x-rays, and answer all financial related questions for the patients. The back of office is required to know all of those things, plus their own duties in the back. They have to suction, take x-rays, explain procedures to patients, explain at-home care to patient, a lot of assistants will be taking out the trash, cleaning their rooms, their operatories, sterilizing instruments, and setting up for the procedure before the procedure starts. As you can see, each assistant is delegated many tasks, so how do they keep the schedule from completely falling apart? So the way the assistants keep the office from complete chaos is they have to work as a team. A lot of times the back of office assistant is considered the floater because they will work in the back and float to the front whenever needed. Oftentimes I'm running from room to room, suctioning, and then I'll answer phones in between, and then I'll go up to the front and check out a patient. So you have to very much be able to multitask. You're juggling many hats at once, and you're never assigned just one specific job. You have many. And punctuality. We confirm our patients the day before to remind them of their appointment. We remind the dentist of how much time we have with the patient, so we don't keep the patients waiting too long in the waiting room, and we don't have any gaps in our schedule. In conclusion, a dental assistant merely assists the dentist. However, as you can tell, it is much more complex than just suctioning or being a spit sucker, as a lot like to refer us to. So as I'm an RDA myself, I will leave you with this. Being a dental assistant has been one of the most challenging yet rewarding things I have ever done myself. I not only get to change smiles, but I get to leave my patients with dental hygiene knowledge. But I learned so much more than just assisting after becoming a dental assistant. I've held hands of strangers, I've given hugs, I have wiped tears, I have comforted people that were truly terrified, and at the end of the day, I am most thankful for creating a connection with my patients and making a difference in their life.